Hi, everyone. We have one of our wonderful co-authors of the book, How Healers Heal, Dr. Nupur Garg. Hi, Dr. Garg. Can you introduce yourself?
Yes. Hello, my name is Dr. Garg, and I am so happy to be here and talk to you about this project that we've been working on. And so a little bit about me. I am a board certified emergency physician, and then I switched into lifestyle medicine a few years ago. This practice is just over a year old that I'm in lifestyle and family medicine, and I love it. So happy to be included in this project. Thank you.
That is so exciting. I love how you've shifted from ER to lifestyle medicine completely. Could you have imagined in medical school, like when you chose your specialty, shifting to something else?
Honestly, no. Part of the reason that emergency medicine appealed to me was because it was a little bit of everything, and I had nothing really was drawing me to be like, oh, I need to be this particular field and just focus on this particular slice of medicine. With emergency medicine, you get procedures, you get clinic, you get every single type of medicine involved. So it was really, really fun to practice. I still practice shifts. I still do shifts and I love it. So I did not imagine switching. Definitely this lifestyle medicine was a life calling that I had to answer.
I love it. So tell us more about your clinic these days and how, well, first, actually, let's go back. How did you get introduced to lifestyle medicine and then get into your current practice at clinic and how you help patients?
Yeah. Definitely, yeah. So, my story is a little different. I had never heard of lifestyle medicine. I guess it's been around for a while, but I had never heard of it until I started researching for my family. My son was about 6 months old, and my husband's vegan, so he wanted to raise our family vegan, my kids vegan, and I was not raised vegan, so I did not know about the nutrition of a plant-based diet and what that would be like, and what kind of because you have to be a little bit careful about where you're getting all the nutrients from and I just wanted to make sure that I was being thorough about that. And so I started doing research, really not expecting to find much about the nutrition involved with raising children. And if I was going to find something, maybe it was like a blog post or something like that, that I wasn't really going to adhere to that strictly because it's somebody's opinion versus actual science. And then as I started on my path, I did find a really awesome podcast that I liked called Nutrition Facts by Dr. Michael Greger. And I was just listening to that in the car over and over again. I was sharing it with my friends and family, and people had listened to it too. And it was fun to talk about. He is really rigorous about the science that he presents. And that really appealed to me. I'm very analytical as a person. And so I was just starting to sort of piece things together, and at some point, he did mention the field lifestyle medicine. And I was like, did he just say like what is lifestyle medicine? I don't even know what that is. So I actually Googled it and I was like, what? There's like a whole field of medicine that I had no idea about. It has its own board certification with an entire curriculum that is trying to teach people what I wanted to know about how to raise a family and things like that, and what is proper nutrition and things like that. So I was just very shocked to find out. I signed up for it immediately just for my own self. And when I did that, I actually also searched for nearby lifestyle medicine practices. I found one a sort of 45 minutes to an hour away from me. I went and visited, and they were so sweet. They were so nice. Part of the founders of that was actually is related to Essel Steen, who's another founder of lifestyle medicine. And so they told me that whole history, and I was just shocked that there was just this world, and the studies that have been done, and I hadn't gotten so far in my studies to know all the stuff they told me, and I was just the more I sort of like scratched the surface and dug deeper, it just felt very very I want to say like it felt like me. It felt like who I was and who I wanted to be as a physician, and what I wanted to know and what I wanted to teach people, and what I wanted to make sure that people knew for their health, like as a physician. And so it just really fit me so well. And it turned out that I started using it in the emergency department, just kind of just like talking to people in their stories. I remember one of the first times it came up was like a patient who came in with stroke-like symptoms, and he said, just by the by, he just said, like, it seems like every time I have Chinese food, I have these stroke-like symptoms. And I think in the past, before I had done lifestyle medicine, I would have just like ignored the comment, being like, this guy never wants to change or something like that. And just, really, I was jaded. But after I did it, I sat there and I listened to that comment, and I heard him, and I really heard him. I heard what he was thinking, and he doesn't know enough medicine to know what he's trying to piece together. And I saw that in him, and I was like, okay, let me just sit there and talk to you a little bit about how lifestyles actually, how it raises your blood pressure with the salt and all this stuff. And I was sort of just like, and he was like, I am never having that again. I really do want to, like, he really wanted to be healthier in that sense, even if he didn't know like all the changes that he would have to make. I had another patient who came in who really needed to be admitted and evaluated for his kidney function worsening. Well, because you're a physician, his creatinine went from 1 to 5, and I was like, I can't really discharge you with that kind of jump, and he's fatigued and can't get up. So I just said, he's like, I will do anything. I will do anything. Just tell me what to eat. Tell me how to live. I will do anything. I will not go on dialysis ever. I wasn't telling him he had to be, but he knew what that meant when your kidney function sort of like starts to decline. And he's like, I know I haven't been healthy, but if you tell me, I will do exactly what you say. Before lifestyle medicine, I wouldn't have been able to help him. And then after, I was able to. Another patient couldn't tolerate statins, kept coming in for strokes. Again, like, we never offered them lifestyle medicine type of, and so it comes up in the retirement. It turned out I was pretty good at talking to patients about it. And I was like, let me just set up my own little practice. And then it turned into my full-time job. And everybody loves it. I love it. It feels good every day. So that's kind of the long story about how I got into this field. But yeah. So you started just for me first, and then I just started to apply it, and then I loved it, and I just wanted to do it more and just opened it up.
That's amazing. I love it. You're just changing patients' lives in the ER and now in your clinic. What is the name of your clinic and where are you located?
It's Lifestyle and Family Medicine, and I am in North Haven, Connecticut, which is right outside of New Haven. It's one of the New Haven suburbs. So.
And so you're doing this full time, and you said you have some shifts in the ER as well.
Yeah, so I do a few shifts in the ED, and I'm practicing. So I have what's called a direct primary clinic set up. So it's just me in this clinic, and I have very long appointments with my patients. I really felt like the model of direct primary care really aligned with lifestyle medicine in that the incentives are for prevention and improvement of patients' health versus like I only get paid if you're sick, and I didn't want that incentive. I wanted to be incentivized to keep people healthy, and so I really like that model. So that's the kind of setup I have here, and yeah, it's just me in this clinic, and everybody kind of like comes in, everybody's on an action plan, everybody's supporting each other. We have cooking classes, fitness classes. It's a skill power over willpower, we like to say. So building people's skills and really giving them the tools they need to succeed. I took a patient grocery shopping the other day. That was fun. So it was really just, he was really, really interested in just not being on medication. And he said, like, if I could do something to improve my lifestyle, then I should do it. And people are motivated. They want this. And it's just, I'm the only practice in this area. The closest next one, like I told you, is about 45 minutes to an hour away. And so it's just a little, I want to say it's like, is people's like haven in the healthcare system to come and get that information that they're looking for, to not be on to live the life that they want to live, whatever, however it is that they want to phrase that, to live to be 100, to live the, whatever it is that their goals are. So yeah.
I love that phrase that you just used, skill power over willpower. That's amazing. And you took someone grocery shopping? Wow.
Yeah.
And then you
It's a
mentioned
start
the
thing.
whiteboard before we started recording. Can you tell us more about this amazing whiteboard behind you?
I love the whiteboard. I have one here and I have one out in our bigger room when I have like more people. But in this office, my patients sit like across the table from me, and I have the whiteboard right behind me. And I will use my markers and I will draw out what's happening with their hearts or their brains or their vessels. The most recent picture was about diabetes and how glucose needs insulin to enter into the cells and what's happening with that. If you have too much glucose, then how that, or you can jam up the locks that insulin has to enter as a key to unlock the cells to let the glucose in, and how medications change things and how diet changes things. So I just like to explain the physiology, and patients really understand it. I like analogies, so they really get that, when I use these kinds of analogies. And honestly, medicine is its own vocabulary, so I never expect patients to use the correct words because it's like learning a new language. That's like, I feel like that was like most of med school. It's just like learning the language of med school and then putting the pieces together in a way that makes sense conceptually. But I do really try to speak to the patient in a way that they will definitely understand in what's actually happening to them, because I think they need to know, especially to make the choices that we want them to make. And they like to know. They like to know. They like to be able to explain things. So to their family, to others, they like to be able to understand it to that level where they can then explain it. So yeah.
You are so inspiring. So can people
Oh,
come see you virtually, or do you only do local visits?
I think I want to do more virtually right now. It's been pretty busy with the local um clients, but especially I want to say like when my panel gets full, because I'm only going to be taking 300 patients as primary care patients. What I want to offer is like lifestyle medicine consultations only, and that would be like a sort of like a 1 hour, let's go through all of your results and everything and see where you are, and what can we do, like the biggest bang for your buck, put everybody on like a 5-point action plan. They can come back at any time and we can talk about it more. We can troubleshoot things and just whatever I do with my patients, but like not be their primary care, and just focus on lifestyle and not prescribe, like if they need a prescription, they would just go to their own primary. But so I do want to do that in the future. So stay tuned for that. But in the meantime, I think I'm just gonna stick to filling my panel. It keeps me pretty busy. My first appointments are 2 hours long, and I do like a 1 hour physical. So it just takes time to do that because there's only so many of those you can do in a week, and you have your regular, like people who need things too. So yeah, but I will fill up, and at that point, I want to be able to help other people too, even if I close my doors to primary care patients. So yeah.
You're amazing. I'm sure your patients have never experienced the type of medicine you're practicing
I
in
don't
this
think they have.
century.
Yeah. What I like to say is I set this up the way I think healthcare should be delivered, not the way insurance companies or healthcare systems want it to be set up. This isn't about quantity, it's about quality. So that's kind of what I like to say. But I love it. If I feel like physicians need satisfaction too. And we all entered this job to provide that healthcare, and sometimes we're stuck in these systems where we really feel like we're not doing the way, like, justice sometimes, and it's not usually our fault. Like it's like usually we want to do more, and it's just so hard. So I just wanted to not have that feeling.
Well, that's
Yeah.
the perfect transition because I was going to just say, doctors and healthcare professionals who are interested in lifestyle medicine and wanting to do and make the impact that you're making, they can go to the American College of Lifestyle Medicine and check out certification. And you've done a huge step in helping them with your book about lifestyle medicine board
Yeah.
certification and the exam. Can you share a little bit about your book?
Yeah, so this book came about, it's called Guidebook to Ace the Lifestyle Medicine Boards. And this is a not for resale copy that I just keep. I had a couple of co-authors as well. And this book came about because these study buddies of mine, when we were studying for the exam, we would reproduce our foundations of lifestyle medicine book into tables and charts and teach each other with those tables and charts. And then at the end, when we took the test, we all felt like we knew a lot. And, it just felt like a good, like we had processed it all. And so I felt like our, the foundations book that we get from ACLM, it's not in tables. It's like mostly just like drop down lists, and it's really redundant. And I didn't want to use that to reference during my practice. And I just felt like the materials that we had created, other people could benefit from in terms of studying. So we did, and a couple of us, two of us really, that was like a lifelong dream of ours to publish a book. And hey, now I'm gonna be involved in two books with this project. So we decided to, and it was more work than we thought, but we decided to reproduce, put all of our material into one manuscript and sell that. So it was very popular. People who bought it really liked it. And we really enjoyed it. I use it all the time in my practice, and sometimes I'll actually photocopy my book and give patients lists of things like sleep hygiene and things like that's been one of the ones that I've used a lot. And then so it's been really helpful to have it in that format. And so that was a project. I knew that I was going to be practicing in lifestyle medicine in some shape or form. And like I said, I didn't want to have to turn to that other book to reference for material that I wanted to look up. I did start to just like put like stickies on things and like in the pages so I could find things easily, and it was just too much. And this was just like a much better format. I knew where everything was and I could just find things much better. So this ended up being a project that I worked on. And so we just updated it. We just put out we just made some corrections from last year's version and put that up on Amazon. So that's available. Patients have bought this book, interestingly enough, even though it says it's like for acing the lifestyle medicine boards, but because it has all the content in it, why not? They're interested and they can find all the information in the book as well. So yeah, it's been
I was
fun.
just going to say, it sounds more than just a study book. It sounds like almost a handbook of lifestyle medicine that's very easily accessible with some quick tips and deep data as well. So, wow, congratulations to you on that. And everyone
Thank
should
you.
check out that book if they're interested in lifestyle medicine certification. So I'm going to shift gears to our book, How Healers Heal. Why should doctors or patients read this book and your chapter?
Yeah, so my chapter, well, I want to answer one other question too. And then I will definitely answer that one. But I also want to answer like what it meant for me to be a part of that book. And I just want to thank you for like taking on this project and allowing all the authors to contribute their stories. For me, the journey of doing lifestyle medicine was, I think it was like more than I could process in terms of what I was at the time. My daughter was just born. She just turned 2 today, actually. So today's her birthday. And so I got my certification that year. And so she was a newborn and there was like a lot going on. And I knew I wanted to learn the material, so I was learning it. I actually, during my exam, I actually had a pumping break because I was like pumping from like during at that time for my newborn. But it was just, a lot. But when you propose this book, when I actually sat down to write my chapter, it almost felt like I was journaling about and reflecting on how my purpose as a, especially career driven purpose and who I am as a person fit within this realm of lifestyle medicine. And it was just a really reflective experience that I really cherished, that I really, really appreciate. My chapter does focus a lot on my background and my lifetime experiences that led me to maybe be ready and ready to be able to access what lifestyle medicine actually is and meaning and what it could mean for the world. And so leading up to that, what my life experiences were, who I am, how my brain works, and why it needed something more than just like, these are good for you type tips passed down from generation to generation. Like I really did need the studies to sort of like comprehend what a healthy lifestyle could actually be and put all those pieces together, and why physiologically why that is the case for what we know now from research, what is actual evidence-based lifestyle medicine, positive lifestyle traits. So I think for me that was like the best reflection experience. And and you can see it's a really personal, intimate story that I tried to put in there, leaving all the good and the bad, and also a little bit about my own personal journey in improving my own lifestyle and how the struggles, and I think really when we as physicians, and we learn this in lifestyle medicine, when we talk to patients, if we aren't doing some of those things ourselves, it's really hard to relate to somebody, to ask them to do some of these things that we know are going to be hard. So any time you're trying to change somebody's lifestyle, you're not saying, I think you should gamble more, it's fine. I think you should drink more, it's fine. It's usually taking away some of the fun, taking away some of the pleasures, and doing that and not relating to them in that struggle, it's less likely to be successful. And so what a patient can take away from this is that we also have been down those paths. Like, we as physicians, even though you are sitting there in this hot seat sometimes and we're looking at your labs and we're doing your evaluation, you can see 30 plus physician stories about how we also have tried and struggled and failed and succeeded, and what worked and what didn't. You'll get a lot of tips out of this book. And so I really do think from a patient's perspective, it could be so powerful to just have that information to help them, to inspire them. And then from a physician's perspective, again, it's inspirational. Physicians are also patients. They also need, no one has a perfect lifestyle. We're all on an action plan. And then also, as a physician, if you were interested in lifestyle medicine, you'll get a lot of information about what the people look like who are doing lifestyle medicine, the variety of how they're applying it, and just where they came from, what inspired them, and they might really see relations to who they are, and sort of answer the why question for themselves sometimes through reading other people's stories. And I think that's really powerful, like just to like relate on that level, and then decide, is this your purpose? Is this not? Are you going to apply it and change your career completely like me, or are you going to apply it just in your regular job, which is still very important? We still need people out there doing it, applying lifestyle medicine in every single field. So you'll see a little bit of everything in this book. So yeah.
I agree with you so much. It is so inspiring to just see the human experience that we physicians have had through our stories. Happy birthday to your baby girl.
Oh, thank you, sister. Yeah. So exciting.
What is one takeaway that you could tell a patient today to, start their journey in lifestyle changes? Doctors or non-doctors, all patients, like you said, doctors are patients too.
I really think that what helps my patients the most is when I bring it back to their why. So what is your goal? Like, what do you want from your health? Like, what is it that, because if I'm not achieving your personal goal, then what am I doing for you as a physician who's supposed to be helping you with your health? So I always try to help people understand what their actual why is. And a lot of that comes down to your own sense of belonging or purpose, or who you are with your relation to whether you have a family or not, or your career or not, or like your personal health goals. If you have a personal achievement that you want to have, like an Olympian, or not even that, just like becoming 80 or becoming 90 or becoming 100. So I think everyone's goals are a little different, and it comes from your entire life experiences. I'm not judging. And I think if you don't have a goal to sort of like be healthy, then what am I doing trying to help you be healthy? So it really does have to start there. And then we go from that motivation to where you can actually achieve. So what are things that you were already thinking about changing? And let's start with that and what we could do to make progress with that. And so those are some of the things that's how I would start with all of my patients. And then other tips are always just about like, try not to force yourself to do something. If it's really not fitting and you feel like you have to do a lot of willpower to get yourself to go from point A to point B, use the tools that exist, whether it's being on meds temporarily, I don't shy away from like, you know, a lot of my patients come here because they want to avoid medications, but I always tell them that like use them as tools, not as a long-term therapy, as a band-aid for changing your lifestyle. Use them as tools to get to the point of changing your lifestyle. And so use the tools that exist out there, whether it's a prescription medication or not. It could be something else. It could be a friend that you're leaning on. It could be a job that you take. Use different kinds of you know, resources, and yeah, find a lifestyle medicine physician to help you because they're trained in identifying those, and they might know, especially the local resources that are out there. And so that's actually this year's project, because I'm in year 2 for my clinic, is to identify all the local resources for free or for paid that can help my patients. And so we have people working on that too, and it's been really fun. And so just having that for my patients has been really useful. So yeah, use the tools. There's also a lot of communities out there who are struggling with the same exact thing that you're struggling with, that you're trying to change, whether it's the plant-based diet or exercising or whatever it is. So joining those kinds of communities. There's some social media ones, there's some in-person ones. So wherever you can find support that way can also be really helpful.
Wow, you have just such inspirational words. So using medication as like a bridge, using your resources as a bridge to get to your goal, and not as, you know, the end all be all and being depressed about being on medicine, but use it as a tool
Right.
and as a bridge to your goal. I love that. That is perfect.
Yeah,
Okay.
I think it's like a message some people really, really need to hear. But if not being on meds is your goal, then sometimes it's more motivating to like just make really strong lifestyle changes that way. So it just depends on the person. Like I said, what is their actual goal from their health, what they want. So yeah.
Well, we've gotten so many like wonderful nuggets of wisdom from you today, Dr. Garg. Is there
Yeah, thank
anything else
you.
you want to share? And of course, I will list information about your clinic and ways to connect with you. Anything else you want to share to our listeners?
You.
And everyone go out and read the book and read Dr. Garg's chapter as well. Go ahead. Anything else you want to share?
No, I just want to give everyone, you know, credit first of all for listening, and also I want to let everyone know that they can do this. Everyone can do this, and I want everyone to feel like that this is a possible thing that they can achieve, and they're not alone, and this is going to be the future, and we're working on it. We're working on it on a federal level, on a state level, on a community level. There are a lot of people involved with making changes here, left and right. So we are very hopeful that this will become the mainstay of how medicine is practiced. And hopefully you'll be seeing more of this. Um, and you know, like hopefully this will also help people regain trust in the medical community. I think that's a huge part of this as well. We're not all bad actors trying to push pharmaceuticals or things like that. There are a lot of us who really believe that you can do this. And I really hope that everyone can find that in their lives, a physician who believes that you can be healthy and that you trust. So, yeah, that's it. That's all my
That
advice.
was so beautiful. Thank you so much.
Mhm.
And we'll see you when you read the book. And
Thank
thank
you. Thank
you.
you. Appreciate it. Thank you so much again. Take care. Bye.
Bye.